Imagine this: you wake up one morning with a scratchy, raw feeling in your throat. It's painful, uncomfortable, and you immediately think, great, another sore throat. But here's the thing, it's not just any sore throat. It could be something more serious, something that can sneak up on you even without a telltale fever. Yep, I'm talking about strep throat. We tend to shrug off sore throats, don't we? Maybe you grab some tea, hope for the best, and push through your day. But what if ignoring that sore throat means spreading a highly contagious infection to your family or friends? What if it leads to complications that could have been prevented with a simple test? In today's video, we're diving deep into strep throat. What makes it so tricky? Why can you have it without even knowing? And most importantly, how can you protect yourself and others from this sneaky bacteria? Stick around, by the end, you'll have all the tools to handle strep throat like a pro. Section 1. What is strep throat and why should you care? So, let's get right into it. Strep throat is a bacterial infection caused by group A streptococci, or simply put, a bacteria that loves hanging out in your throat and tonsils. It's like that uninvited guest at a party, eager to spread and hard to ignore. The main reason people care about strep throat. It's painful, for sure, but it's more than that. If left untreated, it can lead to some serious complications, especially for kids. We're talking about things like rheumatic fever, which can mess with your heart and joints, or even a kidney infection. And here's the kicker, it's highly contagious. Most of us associate strep throat with a super sore throat and a fever, but here's where things get tricky: you don't always need a fever to have strep. That's right, you could be walking around with strep, coughing, chatting, sharing a drink with your friend, and not even realize you're spreading it. This is why understanding strep throat isn't just important for you, it's important for everyone around you. Section 2. The sneaky symptoms you might be missing. Let's talk symptoms. When people think about strep throat, the first thing that pops into their head is the sore throat, the kind that feels like swallowing razor blades. But strep has more on its menu. Some people with strep will have a red throat, swollen tonsils, or even white patches in their throat. Others might get headaches, swollen lymph nodes, and yes, sometimes a fever. But here's the plot twist: not everyone with strep gets all the classic symptoms. Some people might not feel sick at all, yet they can still pass it on to others. Think of strep throat like a bad cold's mysterious cousin. Sometimes it shows up with all the usual drama, and sometimes it's just lurking in the background, causing trouble without making a scene. And this makes it really hard to know if what you're dealing with is just a common cold, or something that needs treatment. So, how do you know? You get tested, and we'll cover that in just a bit. Section 3. How does strep throat spread so easily? Let's break down how strep throat spreads. It's not like some silent ninja slipping through the air, it's more like a sticky situation. Strep bacteria spread mainly through respiratory droplets, which sounds fancy, but really it means that if someone with strep coughs, sneezes, or even talks too close to you, you're at risk. You can catch strep by sharing food or drinks with someone infected, like sipping from the same straw, big mistake. Touching a surface they've coughed or sneezed on and then touching your face. Even breathing in the droplets if you're around someone who's infected. What makes it worse? People can be contagious even before they show symptoms, and some people never show symptoms at all. They're what we call silent spreaders or carriers. So, just because you feel fine doesn't mean you aren't carrying around these little bacteria, ready to pass them on. That's why strep is everywhere, especially in crowded places like schools or offices where people are in close contact all day long. Section 4. Diagnosis: why you need that quick test. So, here's the good news: there's a quick way to find out if you have strep throat or not. If you go to the doctor with a sore throat and strep is suspected, they'll likely do what's called a rapid strep test. This involves swabbing the back of your throat, uncomfortable, but quick. And the results are fast too, often within minutes. If the test is positive, congratulations, you've got strep, and now you can start treating it properly. If it's negative but your symptoms scream strep, the doctor might send the swab to a lab for a throat culture, which can pick up on things the rapid test misses. It's especially important to catch strep early in kids, because they're more at risk for complications like rheumatic fever. For adults, the risk is lower, but it's still crucial to get diagnosed to avoid spreading it to others. Section 5. Treatment. Getting rid of strep the right way. So, what happens if you test positive for strep? The front-line treatment is antibiotics, usually penicillin or amoxicillin. These are your best friends when it comes to knocking out group or streptococcus. If you're allergic to penicillin, don't worry, there are other antibiotics your doctor can prescribe. Here's the key though, you have to take the full course of antibiotics, even if you start feeling better after a couple of days. Cutting your treatment short is like throwing in the towel before the job's done. You might feel better, but the bacteria could still be hanging around, waiting to make a comeback. During treatment, you're still contagious for about 24 hours after starting antibiotics, so it's essential to take precautions like washing your hands frequently, covering your mouth when you cough or sneeze, and avoiding close contact with others. This helps prevent spreading the infection to your family, friends, and co-workers. And what about pain? Over-the-counter pain relief like ibuprofen can help ease that sore throat and any headaches or body aches that might come with strep. Section 6. Carriers. What happens when you're not sick, but still have strep? Now, let's talk about carriers. You might test positive for strep but feel totally fine, no sore throat, no fever, nothing. In these cases, you're what doctors call a carrier. While carriers are less likely to spread the infection and are very unlikely to get complications from it, they can still test positive, even if the sore throat is from something else, like a virus. The good news. Carriers don't usually need treatment unless they're in an environment where strep infections are causing problems for others. If you're getting frequent sore throats but your tests always show strep, talk to your doctor about whether you might be a carrier. Section 7. What if it's not strep? Other causes of sore throats. But what if it's not strep? Sore throats can have lots of causes, and more often than not, it's something else. Viruses, like those that cause the common cold or flu, are the most common culprits. Smoking, allergies, or even just talking too much can lead to a sore throat. So, if your sore throat comes with a runny nose, cough, or sneezing, chances are, it's not strep. But if you're concerned, it's always better to check with your doctor, especially if symptoms persist. Conclusion: protecting yourself and others. So there you have it, strep throat might seem like just another sore throat, but it's a tricky, contagious, and potentially serious infection that deserves your attention. Whether you're experiencing symptoms or you're worried about spreading it to others, the key is to get tested, follow through on treatment, and take precautions. Remember, taking care of yourself means taking care of those around you. Be aware of the signs, get diagnosed early, and treat strep the right way. That's how we stop strep throat from spreading and keep everyone healthy.